You're tuned in to Women in America, the podcast that dives deep into the issues shaping gender equality in the U.S. and beyond. Hosted by Pari and Eve, public health professionals by day, content creators by passion, we bring you expert insights, compelling stories, and actionable strategies to push the fight for equality forward. In today's episode, we cover all things Texas, the measles outbreak fueled by declining vaccination rates and misinformation that's putting communities at risk, to the recent coordinated attack on abortion rights, where a midwife has been arrested for the first criminal case tried by the state since the overturning of Roe v. Wade, while the state legislature advances a new bill that would gag the discussion of abortion online. And these two things are not a coincidence. Both of these issues are setting a dangerous precedent with national implications. Let's dive in. All right, so you know what I had to do this week?
What?
I had to get blood work done because I had just like an annual exam. And I didn't even used to get annual blood work, but I did. I've started to, like, ever since I turned 30. And so now it's like every year, what's the surprise going to be?
Yeah, I know. It's good
Have,
times.
have you gotten blood work done recently?
Oh, well,
I guess you
yeah,
have
like tons
because
of times because I just had a
pregnancy.
baby.
Uh-huh.
But yeah, during pregnancy, I think there was at one point, it was either for genetic testing or for a combination of different things. They took like 15 vials at once.
Ugh.
And when they said, "Are you comfortable doing this today?" I said yes, not knowing how much it was going to be. So when the nurse came in with all of those vials, I was like, "Yeah, I'm going to need a juice stat."
Yes.
And she got me a little Capri Sun fruit punch pack, and it was like a throwback bougie juice.
Yeah,
And
like
I
the
was
one you
just
have
like,
to stab the little straw in.
yeah,
Okay.
she pre-stabbed it because
Oh,
that's how we roll.
okay.
And yeah, and she handed it to me, and I was just sitting there kicking my legs while drinking this Capri Sun fruit
15
punch.
vials?
Yeah, I think it was all sorts of genetic testing and then diabetes and then all, I don't remember what all it was because there were so many different instances where I also gave blood. But yeah,
Oh my
anyway, don't want to
God.
take away from your blood work
Yeah.
story.
No, that's crazy though. I don't think I've ever had that much blood taken. I only had 3 vials taken because they test for like vitamin deficiency when you're an adult, right? They're looking for like
Mhm.
vitamin deficiencies, high cholesterol. I also didn't realize that they checked the volume of antibodies in your bloodstream from your past vaccines. And so
Oh, cool.
I found out today, I got the results. Don't worry, everything's fine. I'm very healthy.
That's
Except for
good.
the fact that I have to redo my Hep B vaccine, my hepatitis B vaccine, which was a series that we got probably when we were in middle school. It was like 2 or 3 vaccine series. And
Mhm.
I thought it was for lifetime, which it may be for some people, but they were tracking that the antibodies in my system were too low to protect me if I was exposed to Hep B. And so now, as an adult, I have to redo the whole series. Great.
Well, I mean, now that you know, I had to redo Hep B while pregnant.
Ah, you
And
did.
I don't know if it was because they said that antibodies were low or it was just like, okay, it's been a certain number of years since you had your last one because baby can't be vaccinated against that until a certain age. And so it's like it provides immunity in the interim. Yeah.
Against Hep B, and also, which is probably scary for you right now living in America, measles, right? She can't get her measles vaccine.
Yeah, so babies can't get their MMR vaccine until they're a year old,
Mhm.
which is, I mean, all vaccines, the majority of vaccines, I believe, are reliant on herd immunity. But this
Mhm.
is like a concrete example of why that herd immunity is so critical
Mhm.
because there are vulnerable people amongst us that even if they wanted to, could not get the vaccine. And in this case, it's like a baby that's still growing and developing and strengthening, and
Mhm.
she is totally susceptible.
Yeah,
And I made a post about this a few weeks ago. It's actually her debut on our social media
it
account.
was the back of her head debut.
Yeah. And that's as far as we will be getting.
And
But
if y'all haven't seen this, you should go see it. It was the most epic debut because it was literally Pari doing the lip sync to the Glorilla song where they go, fuck y'all. And it was Pari saying, fuck y'all, with her middle finger in the air in the back of the baby head in
two
reference
anti-vaxxers.
to anti vaxxers. It was
Yeah.
epic.
And you know what? This one person, like reasoning with anti-vaxxers is beyond me because I cannot reason with that logic. But there was this one person in our comments who was like, I am pro vaccines, but
Mhm.
also you cannot be telling these other parents to vaccinate their children just to protect yours. And I'm like, okay, I just had a new baby.
Mhm.
She can't be vaccinated for this specific thing until 1 year old. What do you propose I do? Do you know what her suggestion was?
Oh God.
It was, don't leave the house. So
Obviously.
don't leave
Obviously.
the house for 1 year, you postpartum mom.
And
How dare you
that's like
consider going outside?
that's her solution to the fact that there is a measles outbreak in Texas currently because there was a pocket of people who weren't immunized. And so now they haven't immunized their children, and the school vaccination rate has fallen below 95%, which is the threshold you need for herd immunity. So now the community's
Yeah,
unprotected. And now there's how many people have
I
measles
think
in Texas?
as of this week, a little over 300.
Yeah,
I'm not
but
sure if it's
there's,
crossed 400 yet. And of course, a child died.
right.
I think she was 7 years old or something.
So I want to talk about her, but it's also not contained to Texas anymore, right? Because like infectious diseases don't know state lines. So it's moved to
Yeah,
surrounding states, and they've even found it in New York, like because people are traveling. And so now it's just, you don't know where it is in the US. So as a new mom, it must be really scary for you because it could be in our state. Like we don't know where it is, it's everywhere.
it seriously is. And also, rubella is starting to make a comeback, which I can't
Oh.
believe that we are here. Actually, I just got a text this morning, one
Hmm.
of those automated texts from Walmart being like, oh, the CDC recommends the MMR vaccine.
Hmm.
Please check your status and come in to get vaccinated. And so many things about that text made me be like, what? First
Hmm.
of all, the fact that we have to promote the MMR vaccine in
Which
2025 blows
is
my mind.
measles, mumps, and rubella, all tied
Right.
into one vaccine.
Yeah.
Uh-huh.
But then second, the CDC recommends, like 5 days ago, RFK Jr. was not in fact recommending that. You had to
Hmm.
wait for a child to die before you start doing that. Like that used to be the recommendation. They took it away. They're
Hmm.
basically just fucking with American lives.
Hmm.
Third, that I was still getting texts from Walmart because what Walmart is on the boycott list. So I'm like, damn,
Right.
I need to fix that.
Unsubscribe, unsubscribe.
Yeah, exactly.
Stop,
But
stop.
like not for the reasons that you might think. I'm not
Yeah.
unsubscribing because I'm anti-vax. But yeah, just and I was with our pediatrician the other day and I asked her, I'm like, hey, so what precautions should we be taking? Are you guys like adjusting the guidelines? I mean, not that they can, obviously, right? And she was like, if you don't need to travel, maybe don't. And also, if you don't need to go somewhere, maybe don't. And I'm like, oh my God, this is actually
You're
starting to
actually
become
telling me to trap myself in
scientific
the
advice.
house.
Yeah.
Yeah.
And she was like, obviously, that's not what I'm saying. And then she just smiled. And I was like, great.
But I'm
And
also
she's
not saying that.
right. She's like, unfortunately, you literally have like one of the most vulnerable people
Oh,
in your house and
sweet.
family right now. And it's just like, yeah, obviously, I mean, we've had our own conversations. We're like, okay, we're gonna stay in parks. We're gonna stay in spaces. It's basically almost like COVID rules again
Hmm.
for us in our own household, but it's insane that that is now what's expected of
Hmm.
us, or like that is the only way in which we can keep her safe.
Hmm. Yeah, and nobody's doing that in Texas. We know because we just said that like hundreds of people have been infected, and that one 6-year-old died, and the parents don't have any regrets. They don't have
Yeah,
any regrets. And they have other children, right? You told me that earlier.
yeah, I have to take a deep breath before I talk about this
Okay.
because
It's very
otherwise it's just like
upsetting.
it's like a stream of cuss words.
Yeah.
And I want to be clear, okay? I felt this way even before I had a baby. Like this is not about me. Like this is very much just like how I feel about how a society treats each other and how a community behaves and how children are treated in our by adults. But
Hmm.
yeah, the I think the video you're referencing is the one where the two parents, they put out this like promo video. I think it was 2 days ago.
Hmm.
And I saw the headline being like, parents of child who died of measles are feature in vaccine video. And I was like, oh my God, they must be making a video being like, we made a mistake. Please don't
Hmm.
ever do this again to other parents. It was the exact opposite of that. They are in an anti-vax video and they actually go and say these exact words. They say, the measles wasn't that bad. Then they say, of their child that died, She is better off where she is.
That is
See,
crazy.
this, I know. And I sometimes I'm like, even the word crazy bothers me because it makes it seem like this is like not how the normal people behave, right? But this like half, no, I don't want to say half the country. A significant proportion of the country
Mhm.
now believes this and thinks that this is valid. And I watched that video and I had to go literally touch grass because I
Yeah.
needed to be reminded of the fact that like this is not this is not normal. I mean,
So
we live in a country where women are literally being jailed for having miscarriages, while people like this not only walk free, but make videos, Eve, promoting that they would do this again.
I know. Well, they
Like
are
they
doing it
said,
again because they have four other children that aren't vaccinated. But can you, do they think that it wasn't measles that killed her? It was pneumonia, and so they're like blaming it on the pneumonia? Like,
like how you don't, why did she get pneumonia? She got
right,
pneumonia because of the measles.
right.
Like,
I mean, we know that, but I'm just trying to like think through their logic because that is psychotic to be like, oh, we still stand like we didn't want to vaccinate because we thought the vaccine would cause autism or whatever their reason was. And what could be worse than that? Well, death. Okay. And then she died, but they're still more concerned about how she could have had autism instead of dying.
well, okay. First of all, Eve, you're doing the thing again where you're
Oh,
trying to
sorry.
bring logic into an
Yes, 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 yes,
illogical
yes.
situation.
Yes.
That's number one.
I'm
And
trying to
secondly,
understand
I
people
don't know
so
what they're
that,
thinking. I don't think you should bother trying to understand people. Can you even imagine trying to put yourself in a situation where you are a parent who has lost your child and your response is, it wasn't that bad? How much worse could it be? Like, what are you talking about? And
yeah,
obviously, the fact that they said the measles wasn't that bad makes me think that, oh, yeah, they're saying that her death was attributed to something else or whatever. But, and not only are these people not getting into trouble, not having child protective services called on them, they are making promo videos encouraging other
yeah.
parents to follow their example. Those are the words they use, follow their
How
example.
is that not child abuse or neglect?
Girl, this is what I ask myself every day. I'm like, okay, like at this point, to me, it is neglect, it's endangerment, it's abuse, not just of your own kids, but
Other
of
people's
every single
kids.
person that your child interacts with past that point.
Yeah.
You know, it's disgusting. And
Mhm.
I don't understand how we as a society reckon with this concept that like there are these people who live among us that just think that it's cool to do that.
Yeah. Also, what is with Texas? Like, Texas is just wild in so many ways. I don't understand. Like, it's almost like the new Florida. Do you remember there was like a radio series where all they did was talk about the crazy shit that people did in Florida and it had
Florida
like,
man.
yes, Florida man.
Yeah.
And now I feel like it's moved to Texas, or Texas has always been like that, where like every bad piece of like state news that hits national news, you can usually guess that it's Texas. I mean, it's a lot of
Yeah.
other states now too, but don't I like parts of Texas. I like Jasmine Crockett. She's from Texas. There's a lot of other cool people from Texas. Beyonce?
Is she?
I don't know. Didn't her wasn't her whole album about like going
Yeah, it is.
to Texas?
I don't
Ain't
know
no
enough
holding.
about
All
her
right.
to know where she's from.
Well,
Maybe I should.
anyway, I don't want to say all of Texas, but in fact, one of my best friends lives in Texas. But a lot of weird shit comes out of Texas,
I mean, I think it's safe to say that the politicians of Texas are the people who we're talking about. But
except
did
for
you
Jasmine,
see?
except for
Right.
Jasmine Crockett. Protect her at all
Okay.
costs.
The
Did I
GOP
think I just said
politicians.
protect her at all costs, which
You
was
did.
a misspeak, but also Texas. So I stand by that.
Context is appropriate. Yes.
Yes.
Amazing. Protect her at
Cross.
all crossroads, at all crosses,
All
everything.
crosses.
Um, did you see the legislation that came out of Texas? I think it's SB 2880, which,
Yeah.
doesn't is not the important part. The important part is that it's basically seeking to ban abortion completely,
Hmm.
no exceptions, no emergency provisions, and also important for you and I,
Hmm.
it is seeking to make talking about abortion a
Hmm.
crime.
It is a
Meaning,
gag.
like,
It's a gag on our freedom to talk about abortion, information, and education.
yeah, and it actually the way it's written specifically references digital conversation. So like
Hmm.
they want to suppress it online. And I believe the bill is such that it would empower any rando
Hmm.
to sue the social media platform if they
Hmm.
saw a video about it. So like, for example, like Joe Schmo on street number 6 in Texas
Hmm.
could sue Meta
Hmm.
if they saw a video of even a physician
Hmm.
just talking about abortion provision, which
Yeah.
I mean,
It's
you
basically
and I,
their bounty hunter law that they passed from like a few
yes,
years ago, now applied to
yes,
the digital space where they're putting the burden and making it cool for private citizens to take down pro-choice websites or pro-choice posts or anything that social media platforms support so that Meta will even further suppress anything having to do with abortion information.
yeah, I was exactly going to say the further suppressed because it's not like they're not doing that right now.
Oh, they
Like we
doing it.
already have to find code words and like whispering and
Schmushmortion.
people, yeah, exactly. And people are always like, why didn't you say it? You're just
Yeah.
like perpetuating stereotypes. I'm like, no, no, listen, this is like, there's actual reasons behind this. But now imagine the social media apps are going to have an actual legal reason to be able to
Hmm.
say, hey, if Pari and Eve put out this video that
Hmm.
normally would have spread and like become, like perpetuated information and
Informative?
education, right? Advocacy amongst people. Now we're just going to suppress and censor that because why
Yeah.
would we risk a lawsuit, right?
Yeah.
And that's just it. Like you're doing this is a Texas bill, but the implications are global
Right. Yeah.
because you are now, your reach is like for anything, any information that you'd see online, period.
Hmm.
And leave it to Texas, right? Like
Yeah.
Texas sees its own self in the past and it's like, hold my beer. I'm gonna do
They only
worse.
compete with themselves, really, because they are
Truly.
like have one of the strictest abortion bans in the country. I have to say though, like that legislation has been introduced, it has not passed yet, so we should continue
Hmm.
to say if it passes because there
If
are
it
lots of
passes.
people working to make sure that doesn't happen. But what I think is crazy is that they also completely understand how popular opinion supports access to abortion, right? We know that like 60, some polls say up to 80% of Americans believe that abortion should be legal in some, if not all circumstances. And having that knowledge, Texas Republicans will try to create a smokescreen when they're passing this legislation so that the public doesn't know about it, right? They create like a distraction. And so
Yeah, I mean they're doing that right
they're
now.
doing that right now with
Hmm.
the midwife
The
who they
midwife, yeah.
arrested. Another crazy story that should get a lot of attention, but also not at the risk of forgetting about this SB 2880 legislation.
Well, okay, so my theory is, and for context, a midwife in Texas has been charged because she has been providing abortion care to her patients. Okay.
Mhm.
And there are a multitude of issues with that. The interesting piece about this is that the Attorney General of Texas, Ken Paxton, he actually had her arrested weeks and weeks ago,
Mhm.
but they did not announce her arrest in the press until this week because SB 2880 was proposed at the same time. And so the media hopped on the Texas midwives case, which they should because it's
Mhm.
crazy and is the
Mhm.
first of its kind. And like she was doing nothing illegal and nothing
First of its
constitutionally
kind
wrong.
in that it's a criminal, like it's a
Criminal
felony in
case.
Texas to be providing abortions outside of the exception. So she's being charged criminally with a potential sentence of up to 20 years in prison. It's the first time that a criminal case has been brought
Exactly.
since the
But
flywheel.
she
Yeah.
is essentially the scapegoat here
Hmm.
because they went for someone who they knew that their base would not be able to rally for. Like they specifically picked a woman of color, a Latina, and obviously went around the abortion piece because they were like, we want something that is going to like get the public riled up and like paying attention to this on both sides so
Hmm.
that in the background we can slip through this piece of legislation.
Hmm.
And that I think is what they're doing. I'm not even sure that they actually care or intend to charge her. I
Hmm.
think they're just using her case as a stepping stone to do this much bigger thing. And so if you hadn't heard previously of this bill that Eve and I are discussing, it's because that's intentional.
Mm-hmm.
They're trying to keep it for you. And
Mm-hmm.
we can do a deep dive on that bill on our page this week. So keep an eye out for that as
Mm-hmm.
well. I really feel like Texas constantly competes with itself and constantly loses. Like it's just
It's like Texas, Florida, Georgia, and recently Louisiana, how they charged that there was like a mother who helped her daughter get abortion pills in Louisiana.
oh yeah.
The quadrant of those states just hates women. I don't know how else to explain it. And I would have included Alabama because of what they did to IVF, but then, the governor came out and was like, this is crazy. We need to restore protections for IVF. I don't say that they love women, but I'm giving them a little bit of a pass because they passed the IVF thing. But the quadrant of the four states between Georgia that introduced fetal personhood laws, Florida, which has a 6-week ban and is just psychotic, Louisiana, who's going after women who are pursuing medication abortion, and then Texas, who has,
Just
these
doing all sorts of things.
bounty laws for everybody where like your Uber driver could get arrested if he took you to the doctor to get an abortion. Like, what is wrong with these places, Pari? What is wrong with
I mean,
them?
you're a better person than me because I'm not letting Alabama off the hook.
Okay,
I'm not letting anybody off the
I
hook.
know.
America, the United States of America hates women, like
Yes.
period. We see that all the time. The most of the time the blue states are just designing legislation to combat the basic level of hatred that exists.
Yeah.
So I think that we are, I mean, protect Jasmine at all crosses. We are at a
Oh,
crossroads right
gross.
now because we are, is in my mind on the precipice of like a few judges making decisions that would have implications on abortion care,
Hmm.
you know, notwithstanding forever, basically. And I say that intentionally. Like, I really think that this Texas bill
Hmm.
is the most important legislation related to abortion that has happened since Roe.
Hmm.
And the reason I say that is because the implications are far and widespread. Like, I think, following the election, a lot of people have been relying on the protection of where they live to be
Hmm.
able to say, hey, I will continue fighting for this. I will continue advocating, but I know that if I need services, I have access to them. And like, if this bill passes, no, you don't. Everything's at risk. And
I mean, every time the like anti-abortion extremists do something in a conservative state, it is with the goal in mind of getting it to the Supreme Court so that they will ban access nationwide. So it might seem like, oh, this will just affect people in Texas, it'll just affect people in X other state, but the whole goal, which is the same strategy that anti-abortion extremists used over the course of 50 years to overturn Roe v. Wade, was trying different cases until they got up to a federal court, until that got up to the Supreme Court to overturn major decisions that protect the rights that we have. So, like, every time this passes as a state law and then gets caught up in court, we get a little bit closer to losing even more. That being
yeah,
said, you mentioned a few moments ago about how a lot of people are relying on blue states, and there are a lot of blue states that are doing everything they can to protect access. So we know that, during the last election, there were 10 ballot initiatives where states were like, we are going to solidify this in our state constitutions, that abortion is,
yeah,
and I think 7 out of the 10 passed, right? One
they
of
did.
them. Mhm.
I was, I don't want to be a wet blanket, but I was going to say, like, one of the ones that passed was Missouri.
Mhm.
And then the Missouri Republicans just undid it entirely. So
Okay, I'm trying to bring us back to hope. So, like, let me
I
just
know.
go for a minute.
I know. You shouldn't ask a woman who's 2 months postpartum about hope. It's like I can't see the light, except in
I'm
baby's face.
trying to give you the light. So, let me
Yeah,
just
yeah.
give you the light. Okay, let me give it to you, and then
Okay.
we can see where that goes.
Light
So,
it up.
10 states had ballot measures to constitutionally protect abortion. Of course, Florida didn't go for it because they suck, but 7 states did. One of them was Maryland. Maryland,
Mm.
Old Bay, crabs. Let me see.
Wait, do people actually call it Maryland?
That's the Maryland accent, Merlin.
Oh,
Remember there was a Instagram
Maryland.
video that went viral of these like bunch of guys who heard their accent and were like, "What the fuck?" And the line was, "Aaron earned an iron urn." And the
Oh,
way
yeah,
they
yeah,
said
yeah.
it was earn, iron, earn. What? Oh my God. Yeah. So
Maryland.
Merlin constitutionalized the right to abortion in their state constitution.
Nice.
Yay. And then recently, this week, they announced that they have been kind of working behind the scenes to create what's essentially their own state grant to financially support women seeking abortions in their state. And that could mean uh, residents live in Maryland, need an abortion in Maryland, or people who travel from across the country from restrictive states to get an abortion in Maryland.
So
And
it's like a state sponsored abortion fund, essentially.
yeah,
Oh,
yeah,
that's neat.
which has kind of happened before at the municipal level. Like we know in
Yeah.
New York and Atlanta, like city councils have decided to
Since I
use
think Cincinnati did it too, yeah.
Cincinnati. Okay, so
Yeah.
three. I thought there was another one, but I couldn't really remember what it was. The idea of using state funds or municipal funds is not new. What is new to this is that these are not taxpayer dollars. This is
Oh.
crazy. This stems from the Affordable Care Act, Obamacare, which, if you
Wait,
ask
but
some
those
people,
are like two different things,
I know,
right?
right? And we're being sarcastic because I don't know if folks have seen this, but there were a bunch of interviews that happened, like street interviews that happened like a few years after Obamacare was passed, where people on the street were asked, "Do you support Obamacare?" And they were like, "No." And then they were asked, "Do you support the Affordable Care Act?" And they were like, "Yeah, of course." And then their mind was blown when they were told that it was the exact same thing. So Obamacare was passed, the Affordable Care Act was passed. Woo! And Republicans being Republicans were like, all right, this can be passed, but in this 900-page document, we are going to allow states to opt out of their state affordable healthcare insurance platforms. We're going to let people opt out of having that cover abortion. And so, like, half the
Um,
states were like, yeah, we out of here. We don't want our healthcare exchanges to cover abortion. And then the other half, plus DC, so we'll say like 26 states, were like, yeah, we'll let our healthcare exchanges cover abortion, sure, because abortion is healthcare. Shocker.
mhm.
So they were like, okay, we'll let people decide this. They can opt out of whether their state exchanges are going to cover abortion. However, the states that allow coverage of abortion, you need to completely separate your funds. So when people pay their premiums and you use that money to then cover like other people's claims in the state, you have to separate out the money that the premiums pay for towards abortion or any other medical procedure because never the two
'Cause
shall mix, right? We have to
right.
further stigmatize this. And
Mm.
so
So you're saying that's how they wrote it.
that's how they wrote it. Yeah. So
Okay.
any state that has allowed abortion to be covered under their affordable health care exchange has to have two financing mechanisms. One that covers abortion procedures or medication abortion, and one that covers everything else. So that's
Mm.
annoying and just an unnecessary split, but here we are. So Maryland said, yes, we're going to cover abortion under our healthcare exchange. And for the last 10, 15 years, they have been saying, out of your premiums, you're going to pay your premiums like you do for health insurance, and all that is going to cover, all of the healthcare that people put in claims for. Then we are going to charge you $1 every month on top of your premium to cover abortion, to cover the
Mm.
abortion, services. And so for as soon as somebody's enrolled in the Maryland Healthcare Exchange, they start paying $1 every month towards abortion services. And this has been happening for the last 10 to 15 years, to the point where Maryland now has $25 million set aside in what I call a piggy bank.
Mm.
That is solely earmarked just to reimburse and cover the cost of abortion services when you're using insurance from the healthcare exchange. These are not tax dollars. These are literally dollars that people have been paying in health insurance premiums. And what took so long is that one, they wanted to accumulate enough money that it made sense to like do something with these funds. But two, they had to pass legislation through the Maryland State House and Senate to operationalize the funds because they had
Mm.
legislation that said, okay, we're going to save all this money, but then there was nothing about how they were going to be able to use it. And so that was just passed this week where the House and the Senate of Maryland both set up a grant that was approved on both sides of their Congress and will now be sent to Governor Westmore, who's expected to sign it. And it's going to be implemented through the Maryland Department of Health. So when providers see a patient who can't afford an abortion, they're able to direct that person or facilitate themselves, I forget the details, financial coverage of that person getting an
That's
abortion in
that's
Maryland.
wonderful.
It
Do
is
you know,
the
so
first of its kind, where they've provided like
yeah,
a self-sustaining finance model for financial aid for abortion services. It's incredible.
that's super cool. I wonder, do you know if that was their goal from the beginning or it kind of evolved over time? Like the idea evolved over time.
I think the goal from the beginning was like we want to set aside money for abortion like Maryland abortion.
There you go, you're in it.
It's my Maryland accent. I mean, it was definitely a set aside money to be able to create some type of financial assistance program, but I don't think they planned for it to balloon to $25 million and also didn't
Mm,
necessarily have an idea of how they were going to be able to implement that.
mm.
So, what's crazy to me, and I need to do more research on this, is like technically there's 25 other states that also have
Also have that, right.
a pot of
And,
money set aside
and
for
they've had to
abortion.
separate it. That's interesting and very intriguing. I wonder if they're like looking at what Maryland has done and been like, hey, we should probably,
I mean,
yeah,
if they're not, that's why we're talking about this. That's why we put it in our Substack newsletter. It's like I am encouraging people to go find out. Guttmacher has a really good map from like 5 or 10
mm,
years ago when the states decided who was going to cover abortion and who wasn't. And of the states that agreed to cover abortion, they're kind of all fair game for having this pot of money. They just have to
yeah,
figure out the different ways that they're going to pass legislation to operationalize it. I also think Maryland is special in the sense that they did this like $1 thing, whereas other states probably just have the standard premium and then had to like separate out, 1%, 5%, or whatever percentage that they decided was adequate for them. Um, but yeah,
but
I
that, I
mean,
mean, that still lends its this is that kind of a setup would still lend itself to
yeah,
this.
yeah.
Actually, now that you mention it, one of our followers responded to our Substack article being like, I sent this to my governor. So I'm like, oh, okay, this is
I know to
awesome.
their
Yeah.
attorney general, which to be honest, I
Yeah.
didn't even think about that. And I was like, oh, this is when it makes it all worth it. You like read something I wrote, you didn't even take my instructions, you took it a step further and we're like, I'm gonna bypass my legislators. I've forwarded your newsletter to the attorney general where I live, and I'm gonna figure out like what's going on here. I'm like, yes, the activists, go.
Yeah. It's kind of amazing, like the Maryland example, and then this individual is just like, what can happen, not just for women, but like what can happen for the health of a people when the people in charge actually know what they're doing,
Crazy.
And like it's not a contentious thing to be like, yeah, we're gonna support each other. Like just yeah.
Yeah.
I
And
love that. That
that's why it's like so important for people to have information because I often think about the ripple effect that we have. We often, you and I will joke like privately that we get so much hate on our channels and it's hard to feel like you're actually making a difference even though we have like a, fairly large platform. But then we get this feedback from like one person that like they learned something from a post or from our newsletter and they went and did something about it. And it's like just them seeding that idea with their attorney general could change the course of the state's plans where they live. That's
yeah,
crazy. So
that's beautiful. That was a lot of good light. Thank you. I need optimism.
I'm like, okay,
Especially
so
in the face of America today.
yeah, which is just depressing every single day. But you have to find the shreds of hope. Otherwise, what's the point of what we're doing, you know? And that's why I love, our friend V under the desk news, how they
Hmm.
do
The
good news,
banana
the
shirt. Yeah,
banana
yeah.
shirts. I want to
Hmm.
find an equivalent for us because I really like, I love their banana shirts. I see the banana shirt and I'm like, I can finally take a breath, you know? Like, I know they're not going to hit me with a shitstorm of stuff. The banana shirt's here. So we could have a gem shirt.
Yeah. And if people have no idea what we're talking
Yeah.
about, there's a wonderful creator who goes by Under the Desk News. That's their handle. And they're usually reporting on, breaking news and doing sort of breakdowns of that. But occasionally, I think it's once a week, they will don this banana shirt. And last week, I think it was a banana hat.
Hmm.
And that's your indication that the video is going to be about good news.
Wait, I want a banana hat, but what's the version for like Gemma? What's the Gemma banana hat equivalent?
Um, oh, we could wear like a giant bling necklace with just a gem on it.
Oh my gosh, I love that.
Both of us have that lying around
Yeah.
casually.
Okay, I think we should source ideas from the crowd.
Mm,
So, for folks listening, if you have ideas on what could we have for like good news gems, what could we wear
mm.
that indicates that you're about to get good news that aligns with like Gemma? We'll source it and then we'll just go buy it and we'll start using it. Send us your ideas.
Do it up.
That's it for today's episode of Women in America. We've covered a lot, from the resurgence of measles in Texas due to falling vaccination rates to the criminalization of abortion providers and the dangerous implications of Senate Bill 2880 that could silence critical reproductive health information. These issues aren't just Texas problems. They're part of a larger, coordinated effort to undermine public health, restrict bodily autonomy, and erode free speech. As always, staying informed is the first step towards pushing back. If you found this episode valuable, share it with your network and don't forget to subscribe wherever you get your podcasts. You can also follow us on social media for updates and resources at Gemma_talks. Thanks for tuning in. Until next time, stay informed, stay engaged, and keep fighting for what matters. We'll see you next week.